Welcome to Kitchen Party Rebel. My name is Kate, your host, a politics student coming to you from my kitchen table here in Mi'kma'ki, the unsurrendered ancestral territory of the Mi'kmaq people. You probably know it better as Nova Scotia, though. This season, we're looking at healing the body politic. We're using two-eyed seeing to diagnose societal illness and relational imbalance in structures of power like our government. I can't wait to share it with you, so let's get started.
Hey friends, welcome back. Grab a seat, pull it in close. Today we're talking about something that hits you right in the chest. Tonight's episode is about health. And I'm not talking about kale smoothies. Like, ew, who decided that was a good thing? Not yoga or whatever wellness trend is currently trying to sell us, I don't know, turmeric scented air fresheners or something. I mean, who lives the longest, who gets care, and who gets told that their pain doesn't exist. If that sounds political, good, because it absolutely is. And that's what we're talking about today. Here's a interesting truth that I feel should be on the front page of every newspaper. Ready? Health is political. Elizabeth McGibbon, who wrote Oppression, says the social gradient of health, which is like the link between inequality and sickness, is not a fluke. It's structural. It's built. It's like a highway that only runs in one direction. Most of us grow up thinking that health is about personal choice. If you eat right and you exercise, you get enough sleep, you avoid eating deep fried poutine after midnight, you should probably be fine and live a decent amount of time. Frankly, the whole avoiding deep fried poutine is a little un-Canadian, but what do I know? But McGibbon says no, 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 no. The real forces that are shaping health are things like racism, colonialism, and classism, hierarchy. The stuff that sits in laws and budgets and bureaucratic nightmares that we all ignore because we've just heard way too much of it and we just don't care. But what it actually means is the government can actually predict statistically who's likely going to die young. Because, newsflash, the system is made that way. Stats can, they absolutely can tell you who's most likely to die first. There's a book I read this past summer called Rehearsals for Living, and it's letters that were exchanged between two people during the course of the COVID-19 pandemic. And it says in one part of it says the urgency of accepting white healthcare ideas is real because we know that brown, black, and marginalized people are the first to die. I had to read that a couple times as a white settler sitting here. Brown, black, marginalized people are the first to die. The government can predict statistically how long each person has to live. If that is making your shoulders go up around your ears or your spine shiver, just know that I feel the same way. It's really hard to sit with. So we're sitting here together with it. Anne Bishop, who wrote Becoming an Ally, gives us a cheat sheet for how oppression organizes itself. She calls it the four horsemen of oppression. There's political power, or who gets a voice, economic power, who gets the resources, ideological power, who gets seen as deserving, and physical power, who gets controlled when they resist or protest, speak up. Put these all together, and you don't just get Cinderella's carriage or inequality, you get embodied oppression, chronic stress that corrodes the nervous system. It's illness that clusters where power doesn't. And it's not abstract, it's medical. There are documented research cases of this, it's measurable. If you need more tangible options here, think of all the boil water advisories in Indigenous communities in Canada. Think of who gets criminalized for addiction versus who can access private treatment centers. By the way, the waitlist in Nova Scotia for addiction treatment and detox is about 3 years long in the public health system. Think of who's believed in the emergency room, who gets told to wait and see. I have a friend who actually, decent white guy, really fairly privileged, except that he is a recreational cannabis user. No problem with that, it's legal, not an issue. He also happens to play sports, and the other day he got injured fairly badly. Um, so enough that when he got home, his family said, "Okay, you can't move. We're calling an ambulance." So the ambulance came, and the paramedics took him to our local hospital, which is a very small community hospital. Fortunately, happened to be open. Unfortunately, the physician that was on that night saw somebody who admitted to recreational cannabis use and decided that instead of running the tests necessary, instead of getting blood work and x rays to rule out serious spinal injury, this person obviously was just seeking drugs. Dismissed him on that. Didn't take him seriously. Handed him half a pack of pain meds without instructions and walked out. Because that doctor 100% believed that he was going to walk out of that hospital, even though he couldn't walk, but walk out of the hospital and sell it to the first person he saw on the corner. He wasn't, by the way, and he fortunately now is feeling a lot better. But that just goes to show you who's believed in an emergency room. We get all of these news stories lately that are talking about people who are dying, waiting in emergency rooms to be seen. Indigenous people who show up to emergency rooms and are left in the waiting area, sometimes for days, because the doctors don't take them seriously. And this is not, we're not in the United States here. This is not about people and having the right insurance or not having insurance. This is Canada, where if you're a Canadian citizen, everybody has the same level of basic health insurance. So why is it that some people can access stuff that others can't? It's not coincidence. It's completely by design. So when we're talking about this, we also need to talk about the bureaucratic labyrinth that people have to navigate just for basic services in this country. Um, I like to refer to it as the healthcare Hunger Games. Just make sure you survive till the end. Jody Wilson-Raybould calls it a jurisdictional maze. It's a web of federal and provincial fights and loopholes and not my job energy that leaves communities waiting for clean water, for adequate housing, or proper clinics, proper medical clinics, health clinics, mental health clinics for decades. And listen, if a community still doesn't have drinking water in 2025, that's not incompetence. That is political choice. Choice being the key word. Elizabeth McGibbon calls this social murder, to borrow from Engels. That's not being dramatic, that's just accurate. Because early death that's caused by neglect is still kind of killing. One of the most cunning tricks of oppressive systems is the myth of scarcity. We saw this a lot during the COVID pandemic, during the early days with the COVID pandemic. How many times have you heard governments on social media or on TV or whatnot talking, and you hear, sorry, we just can't afford mental health care right now. Sorry, Indigenous health programs aren't scalable. Sorry, there's no funding for clean water. Meanwhile, budgets for police services balloon, and our national defense spending is higher and higher. Point is that governments can find money to do what they want to do when they need to. Bishop says scarcity is manufactured to keep people afraid, compliant, and competing with each other instead of questioning power. I have to agree. I think about the early days of the COVID pandemic, and I think about my friends who are healthcare workers, or essential workers, frontline workers, and how scared some of them were. Some of them living in rural areas of the province or in the country, and having to reuse their masks day after day because they were told that there were no masks to be found. They didn't know when the next supply of fresh masks were coming. Meanwhile, the big urban hospitals seem to have an endless supply. You know who didn't have an endless supply and who had to fight for every single one they got, if they got them at all? Indigenous communities, Black healthcare centers, low income vulnerable populations, publicly funded and run nursing homes. Those are the people who are being told that there's just none to be found. And you're hearing this, and it makes perfect sense as to why people were hoarding toilet paper. Myth of scarcity. Maynard and Simpson, who wrote Rehearsals for Living, have a phrase for this. They call it organized abandonment. It means that the state pulls back services in marginalized communities, but then turns around and pours money into punishing those who don't have enough or who don't have the resources. Scarcity is not natural. Scarcity is a myth. It's a curated myth. They tell you what they want you to hear. We also need to talk about what cultural safety actually means. Because cultural safety is not just about being nice to people whose cultures are different than yours. We should always be nice to people, everybody, regardless of their culture and your culture. But cultural safety is a shift in power. It is people in the workplace acknowledging that a clinical encounter is political. It's understanding that a medical misdiagnosis, dismissal, or medical harm aren't just accidents. They follow the same colonial structures built into the states. We look at, again, the emergency rooms with marginalized people being left to die in the waiting areas for days. Let's go across the globe for a second to New Zealand. Um, I want to talk about the Indigenous nurses in Aotearoa. Aotearoa? I definitely did not say that right. They're the ones that have sparked this movement globally, this movement of shifting power and acknowledging that healthcare is political. And their movement has spread because it spoke to something deep. It's the need for healthcare that does not reproduce violence. Cultural humility takes this a little bit further. It's a lifelong practice of self reflection. And Jody Wilson Raybould says that reconciliation in healthcare requires humility from those who have held power and courage from those who have been denied it. Meaning, this is not vibes based allyship, people. This is people who have the power, doctors, nurses, people who have that authority over people, acknowledging that culture is important. And not just acknowledging, but respecting that culture is important. It's courage from those who have been denied that respect to be able to speak up and to say, actually, this is how we do things in our culture, or this is what I believe. A while ago, I don't want to say a long time ago because it wasn't that long ago, there was federal discussion around language and the rights of Canadians to be served in the language of their choosing. Now, there's a whole lot of issues with that because they weren't talking about a whole lot of different languages. Specifically, they were talking about the official languages. So they were saying basically that any Canadian has the right to be served in English or in French, depending on what their preference is. And there's a whole lot wrong with that because it totally ignores Indigenous languages and immigrant languages. But that was cultural safety, the right to be seen and access services in the language of your choice. It's why when you go to Moncton, New Brunswick, if you have to go to the hospital, you have a choice between Hôpital du Mans and the other English hospital, which I can't remember the name of. Yeah, there's a responsibility here. And not just responsibility, there's a command of respect. McGibbon is crystal clear on this. We cannot treat away what politics creates. Those systems of oppression that our political systems and governments have put into place, we can't just treat them overnight ourselves. If colonialism caused harm, reconciliation has to be structural. If racism is causing an illness, then anti racism has to be preventive medicine. And if inequality is causing stress, then equity, real equity, and note I'm saying equity, not equality, is the prescription. Anne Bishop gave us the antidote to hierarchy. She says that power with is collaboration. It's community designed care. It's Indigenous self governance in healthcare services, not as a charity, but because it's a right of Indigenous people. When communities regain control over their own healing, outcomes improve. Not because of magic, but because of relationship. So here's the truth. Who gets to live the longest in Canada is not random. It's completely political, it's relational, it's historical. But the body politic, sick as it is, can heal. Healing starts where it always starts, with telling the truth, both to others and to ourselves. It does nobody any good to walk into a doctor's office and lie about your symptoms. You're not going to get anywhere. We need to refuse the myth of scarcity, and we need to build systems where care is not a privilege, but a practice. Okay, so next episode, we're going to talk about healing as resistance. The fierce, rebellious act of reclaiming power from systems that were never built for us. So, drink your water, stretch your jaws, your legs, stay beautifully, stubbornly alive, and we'll talk soon. Kitchen party rebel out.